My name is Dr. Jeffrey Scott. I'm a second-year resident here at University Hospitals in the Department of Dermatology. I'm the incoming chief resident for next year, and I wanted to talk a bit about burnout. It's one of my interests as I've been a resident in trying to identify burnout, figure out why it's so prevalent, and figure out ways to help reduce burnout and improve resident and faculty wellness. I'm part of the Organization of Resident Representatives, which is a group that is a branch within the AAMC. The AAMC is a large governing body that governs all medical schools and governs all teaching hospitals in the country. And a major focus at the AAMC over the past few years has been on burnout and how to foster and improve wellness within residents. Interestingly, burnout is quite common amongst all physicians, but it's actually quite common in dermatology as well. And between 2011 and 2014, the self-reported burnout rates amongst dermatologists increased from about 30% in 2011 to about 60% in 2014, which was one of the highest increases amongst all specialties. So burnout is not only common within the medical profession, but burnout is quite common within dermatologists. Burnout, from a strict perspective, is defined as emotional exhaustion and a deep personalization or distant and non-caring attitude. And it leads toward increased errors within decision-making processes, and it also leads to reduced wellness within the practitioners. So it's really vitally important to figure out why burnout's increasing and figure out how to stop that. The AAMC has done a lot of research in this area, and they've identified more so than stress on the job, more so than work hours, more so than regulations, they've identified the work environment or the learning environment as the single biggest contributor toward increasing burnout in physicians. And the learning environment is basically the environment that residents and faculty are enriched in every day or exposed to every day. And it includes the culture of the institution, it includes the institutional resources, it includes qualities that make up the faculty, and it includes qualities of the students or the learners. And if the learning environment is so critical and a suboptimal learning environment is so critical in driving burnout amongst residents and faculty, then we really need to figure out, in terms of dermatology, what elements of the learning environment are contributing most and how we can change those to hopefully improve dermatologists' wellness and reduce burnout amongst dermatologists.